Let's do an NCLEX practice question. You're caring for a female client who is receiving chemotherapy. You're reviewing the client's lab values. Which action should the nurse take first? Sometimes practice questions have these exhibit buttons. A little tip is the information you need to prioritize safely is in there. So always click it. When you click on it, it could give you the patient's labs, maybe vital signs. In this case, we have labs. This patient has a white blood cell count of 2,000. A normal WBC count is 4,500 to 11,000. So this value is low. This patient has an absolute neutrophil count of 700 and normal ANC is above 1,500. So this value is low. This patient has a hemoglobin of 11. A normal hemoglobin level is 12 to 16. So this value is low. This patient has a platelet count of 130,000. A normal platelet count is 150,000 to 450,000. So this value is low. The patient has a potassium level of 3.6. A normal potassium level is 3.5 to 5. So this value is normal. Now let's look at the answer options. Start an infusion of packed red blood cells. This treats anemia, but the patient's hemoglobin is low, not critically low. We usually only do an infusion when it's critically low. Start an infusion of platelets. Platelets are a bit low, but not low enough to need an immediate transfusion. Place a mask on the client. With an absolute neutrophil count under 1,000, this indicates neutropenia. The client is at high risk for infection. We need to protect them immediately with reverse protective isolation. So this is the priority. But to be sure, let's look at option number 4. Administer a prescribed antibiotic. Antibiotics treat infections, but we don't even know if they have one yet. Right now, we need to prevent infection first. You can find more NCLEX practice questions like this along with tips, charts, and a schedule in the complete NCLEX study notebook. Happy studying, future nurses.